Hi, my name is Michelle Bronzo, and I'm a therapist specializing in grief, loss, and oncology. Thank you so much for having me at your conference to speak about this really important topic about coping with anticipatory grief. And I'm planning on sharing my contact information at the end in case you have any additional questions or would like to connect. And also I've created a handout to accompany this presentation just so that you can really focus on listening right now and not feel compelled to scramble to write down notes. And we really have a lot to cover in these 20 minutes. So I think I'm just going to jump right into the material. So you all know firsthand that a cancer diagnosis is a life-changing event. Right? Adjustment to a cancer diagnosis includes a multitude of physical, cognitive, emotional, and spiritual changes. And these changes, they can be both big and small, but they're often accompanied by feelings of grief and loss. So I really consider loss to be an inherent part of the cancer experience, and it can be hard to know what to do with all these feelings. So that's what we're going to be talking about today. You may not have heard the term anticipatory grief before. So anticipatory grief refers to the distress that you feel in the present moment in advance of an impending loss. So most commonly, this term refers to feelings of grief that you might experience in, let's say, the days, the weeks, or the months leading up to a loved one's expected death. That's typically where people hear this term. But this term also can describe feelings of loss connected to, let's say, your own future, as well as upcoming non-death related losses. So, for instance, a mastectomy is not a death of a person, but it can be a tremendous a loss that you're knowing is coming your way. So, I thought that we would briefly just talk about the many losses that can occur after a breast cancer diagnosis. This is not an exhaustive list, but it's important to acknowledge all the things that make this experience really complicated. So some of these things may be things that you've already experienced or are concerned about experiencing or know that you will experience at some point in your cancer journey that can bring about feelings of anticipatory grief. So, one of the biggest things that I imagine all of you have experienced is this sense of loss of life as I knew it, right? Life is so different from even just minutes before receiving a cancer diagnosis to the minutes afterwards, right? That there's a sense of, I just can't go back to life as it was before, even though I really would want to, right? That life has changed forever. And that sort of dovetails in to this sense of a changed belief system. So a cancer diagnosis challenges what we call the assumptive world theory. So the assumptive world theory is a strongly set held of beliefs or assumptions about the world that the world is an orderly place, it's a fair place, it's a safe place, it's a place that makes sense. And traumatic events or losses can shatter these core assumptions about the world, right? And as a cancer diagnosis nearly always comes as a complete and utter shock. Most people say that they feel as though it came out of nowhere, out of the blue. It creates a great sense of sort of mistrust about the world, uncertainty about the future, and one's safety in it, right? Because if that took me by surprise in the way that it did, what else could come next, right? So there's a real sense of mistrust about the world and your place in it, which can breed a tremendous amount of anxiety, right? Because there's a loss of control in a really significant way. Some other major ways that people experience loss through the cancer experience is loss of the roles that you once had at home or in the community, and these roles may have been really important to you, and you're not quite sure what to do without them. Loss of relationships. So friends may not know how to support you at this time, and those relationships may change, or you may determine that some friends, that those relationships need to end. And so those can be huge losses. And on the other side of things, right, you may really get attached to fellow cancer survivors that you meet along this path. And when you experience the death of some of those people can be very challenging, right? Both because it kind of can inflame your own personal fears about yourself and your own, cancer journey, but also that you really care about this person and experience the loss of the person for who they were to you. So loss of relationships can be huge. Many people will notice that their work changes or their financial situation changes in a way that's temporary or permanent to accommodate treatment. So you may be in a camp of someone who's struggling to stay employed during treatment, right? You may have exhausted all your FMLA and have to make a decision about leaving the workforce. For some people, that may be a welcome change, but for some others, that can be a huge loss, especially if your work is a big part of your identity and your purpose. So some other major ways that people experience loss or anticipatory loss is through physical changes, right? And I don't have to tell you about all the physical changes that one can experience during cancer treatment. There are a lot of things that fall under this category, but I'm just going to mention a few so that you have a sense of what I mean by physical changes or physical losses. So we're talking about things like hair loss, loss of a body part, all of the physical changes that might occur as a side effect of treatment, specifically cancer-related cognitive impairment, right? That your mental functioning may be either temporarily or permanently altered, weakness and stamina changes, right? You may not be able to physically do what you used to do, and that can affect a lot of what you do socially with people, or even it may impact your career depending on what it is that you do for work. Sexual health and sexual functioning changes are huge and not often talked about, but we know that these kinds of treatment-related sexual functioning and sexual health changes can translate to altered intimacy with your partner, because it can be hard to navigate those conversations and figure out what it is that we need to do in order to sort of accommodate, my new body or our new bodies. Another big category is that of emotional changes. So, this diagnosis can take such a huge emotional toll, right? And the feelings are often very complex and sort of interwoven. It can be hard to pull them apart from one another because they can be so mixed, right? You can feel sad, angry, overwhelmed, in disbelief, out of control, confused, fearful. You can feel all of those things at once. And feelings of worthlessness and hopelessness, as well as suicidal ideations, can be very common. And so if you find yourself thinking about this more than just a passing thought, it's essential to reach out for professional support around this. And so we'll talk a little bit more about how to go about doing this later on in the talk. Another big area is that of spiritual changes. So loss of faith or spiritual distress, existential distress, right? It's common to think about dying and worrying, will I die from this? What will happen to the people that I love if I die? What important things might I miss out on in the future if that were to happen? Because, your mortality is really called into question in a serious way. So these are really understandable questions to ask yourself and to worry about. And so the biggest psychological hurdle that you're likely to face is figuring out, how do I cope with this uncertainty and the unknowns of my future while also planning for the future, right? Will I be alive in X months, X years, right? Becomes a factor in trying to plan ahead. And I've seen that this time and time again in my practice with people wondering if they should do things like, let's say, renew a cell phone contract or plan a vacation or make a big purchase like buying a car or a home. And if you're in that camp of people, know that you can always, let's say, plan for your vacations and travel with the extra security of trip insurance, right? You can always cancel, but if it's not planned, you may miss out on doing some things that you really enjoy in the present. And it's really important to have things to look forward to, especially when you're putting your body through so much and going through so much. I had a group member once who sort of said so perfectly to another group member contemplating this very thing. They said, buy the damn car, just buy it, right? Enjoy it. It can, I understand the sort of the challenge of knowing how to balance the financial demands of treatment with living life in the present, right? I've had some people wonder if they'll be alive by retirement age, and so elect to use the money that they would have used for retirement for things in the present that will allow them the maximum enjoyment of their life. But it certainly depends on your own family situation and what it is that you need to allow for in the future. So that's a great conversation to have with a financial planner or advisor. I think one positive thing that can come from anticipatory grief and living with uncertainty about how much time you have left is that it can have the effect of helping you to reprioritize life in a positive way. So this often, is kind of a crossroads in life for people. And so it may cause you to ask questions like, what is it that I actually want to be doing with my life? Who do I want to be spending my time with, right? It sort of causes you to reevaluate your life and think about what has life up until this point been like, and what do I want my life to look like going forward, so that I can sort of be the person that I want it to be and hope that I would be. And so having this diagnosis can help you focus on what brings you the most amount of joy with the least amount of effort or hassle, right? If you have friends that are high maintenance, kind of toxic friends or exhausting friends, this may be a good time to move away from those kinds of relationships just to conserve the energy for yourself. But this can be a time that's really powerful for people to make major changes that they might not have done had they not been diagnosed with cancer. So, we've spent a little bit of time talking about the kinds of losses that you can experience, both sort of the losses that you've already experienced and the losses that you're anticipating experiencing. So let's take a little bit of time to talk about the concrete ways to cope with all of these losses. So first, I'm going to take a little bit of time to talk about getting support for your mental health. So kind of on the individual side. So Living Beyond Breast Cancer offers some amazing programs to help you cope with the challenges of living with cancer. And one service that they offer is the breast cancer helpline, right? And so don't be afraid to use it. That's what it's there for. And they can also help direct you to services that you may not think that you need. And so they're a great place to start. I certainly am biased because my line of work is in counseling and therapy. I certainly think that having that outlet can be tremendous for anyone that's looking for additional support, because we know that experiencing depression alone or depression with anxiety is extremely prevalent after a cancer diagnosis, because this may overwhelm your natural abilities to cope. And I often see clients that have never had any counseling before, but they're in need of professional support to help them navigate this difficult time. This is unlike anything you've ever experienced before, and so this often is sort of more than people can take on their own, and that's why it can be so valuable to have another person there to share this experience with. When people are wanting to find a therapist, they often struggle with knowing how to go about doing that, where to find a therapist. And so one resource that I will give to you, and again, this is on the handout that you can download, is to use the Psychology Today Find a Therapist search tool. This is where I would go for myself. This is where I would send friends and clients to. And so there'll be a link on the document that you can download. But there's a specific part of the Psychology Today page which has to do with find a cancer therapist. So you can filter by things like location and gender preferences for your therapist, the type of insurance that you have, and it will pull up people that have experience working with cancer. And you'll get a little bio of the person. You'll see their pictures, so you can read through and see if there's anyone that, sort of what they're saying resonates with you. I would definitely recommend calling a number of people, and it's general practice that therapists will offer free 10 to 15 minute phone consultations. And so I would recommend talking to at least 2 or 3 providers just so that you can get a sense of who you feel is a good fit for you. It's kind of like dating. The chemistry has to be there. You have to feel like the person really gets you. And so there's no better way to do that than to have a phone conversation with the person. So definitely take some time to do that so that you get connected with the person that's going to be a good fit. Another resource is the Association for Oncology Social Work, AOSW. They may be able to connect you with a therapist near you as well. And a mental health counselor can provide you not just with emotional support, but they can also help you determine if additional support might be beneficial to you. So for instance, a referral for a medication, which is super common. You may really benefit from medication or medication adjustment if you've been on psychiatric medication before. Again, because this is a time that kind of overwhelms people's natural abilities to cope. Psychology Today also has a tab for finding a psychiatrist. So again, that's linked on the attached document. So that's a little bit about how to go about getting individual support, but group or peer support, support groups can be a really important piece of the puzzle. I want to spend a little bit of time talking about that, especially in how it relates to coping with loss or anticipatory loss, right? In support groups, you're likely to meet people with experiences or feelings similar to yours. And people often say that they can say things to their cancer friends or their cancer group members that they can't say to friends or family. There's just sort of an implicit understanding and getting it, and you don't have to explain yourself. And so it can be really validating to meet other people that are experiencing the same kind of losses that you are or having similar reactions, just so that there's a sense of universality and I'm not alone in this. So support groups can be great just to reduce stress and feelings of loneliness and isolation. Again, that some people struggle with, how do I go about finding these groups? So, you can ask the hospital where you're receiving treatment if they run their own groups, which they might, or if there are local cancer support organizations that are offering support groups. And oftentimes, if there is one near you, they have a lot of different options for programming. And so definitely encourage you to check out what they have to offer. Additionally, you can reach out to LBBC organizations like LBBC, like the Susan B. Komen, to help you get connected to local groups. Another great way to find support, although comes with a little caveat, are private Facebook groups. So LBBC moderates a few of these private Facebook groups, and there are other ones out there. My take it with a grain of salt comment about Facebook groups is that for some people, it can be like going down a rabbit hole a little bit, that there's so much out there, there's so much information, and that sometimes people get overwhelmed by being on these Facebook groups. For some people, they really get a lot out of it. But if you try this and find yourself, falling down the rabbit hole and getting overwhelmed, know that it's okay to step back and say, you know what, this is really too much for me right now. I'm not going to look at it maybe at another time I might want to go back on the Facebook group, but for right now, it's really, really too much. There's another support organization called Immerman's Angels, and they offer one-on-one support. So they'll actually match you with another survivor with your same diagnosis and stage, or they do their best to match you as closely as possible. So it's sort of like a one-on-one person that you can talk with on the phone and text with that is in the same boat as you. And so that can be really valuable just to have one person at least that is, major support. Another thing I'll mention is LBBC's blog for inspiring and empowering stories. Even if you never meet these people, it can be helpful to listen to stories about how other people coped and how they were able to balance life with all of the major losses that it is that you're experiencing, and to regain a sense of control and a sense of joy. So we've talked a little bit about the individual and group support that you might be able to seek out, but for yourself, also, especially if you are connected to a local cancer support organization, they often have programming for stress reduction. So things like art therapy or mindfulness and meditation strategies. There's a program called Mindfulness-Based Cancer Recovery, MBCR, and that's a program that you can do for a number of weeks with a group, but there's also a self-guided journal experience that you can have for yourself that's linked in that document if you wanted to buy that from Amazon and just go through it on your own. That's something that you can do just to help manage all of the stress and anxiety that can come up from trying to navigate all these many losses. And then other kinds of great body work like yoga and acupuncture and massage and other kinds of movement that just release tension, because we know that you hold a lot in your body. And lastly, I think just the critical nature of activating your support network, right? Whether it be friends and family or community groups, faith communities, colleagues, other cancer survivors, right? Connectedness is crucial at a time when you feel so isolated. And I really encourage you to try to break through some of that desire to pull back and withdraw, and instead, work to connect with others, because it's that human connectedness that can make us feel alive. And so I know that was a lot to cover in 20 minutes. We could have spent hours talking about this topic, but just know that anticipatory grief is a really normal part of the cancer experience, but the strategies that we described together can help you manage some of these complex feelings.